A strong healthcare brand is more than a logo or tagline. It's the identity that patients trust, the clarity that employees rally behind, and the differentiator that sets providers apart in crowded markets. But how do you build a healthcare brand that actually resonates? I'm Prentice Howe from Door Number 3, a healthcare branding firm with decades of experience helping providers reimagine their visual identity, clarify their positioning, and design patient-centered branding strategies. And today I'm sharing how to develop a healthcare branding strategy that drives real results. Healthcare is unique because branding is not optional. Patients rely on trust when making care decisions, and branding is one of the most powerful ways to build that trust. Working with a healthcare branding firm means gaining deep industry expertise in medical marketing and identity design, patient-centered brand strategies that prioritize clarity and empathy, guidance on compliance and sensitivity in healthcare messaging, and cohesive experiences across digital and in-person touchpoints. Healthcare branding is not just about advertising services. It's not. It's about improving access, clarifying choices, and guiding patients through life's most important decisions. A healthcare branding strategy is a structured plan that guides how organizations communicate, attract, and retain patients. Unlike corporate marketing, it must consider compliance, ethics, and patient privacy. An effective strategy provides clarity on target audiences and patient segments, messaging and positioning align with patient needs, channels for outreach from digital to community-based, and metrics for success such as acquisition, engagement, and retention. Key components include clear positioning so patients understand what sets your brand apart, a consistent messaging framework across all channels, digital foundations for discoverability, reputation management to build trust, and analytics to measure performance. Patients form impressions long before their first appointment. They encounter websites, reviews, email reminders, and office signage. If these touchpoints feel disconnected, trust erodes. Consistent branding ensures patients recognize your values at every interaction, internal teams communicate with alignment and clarity, and campaigns reinforce one unifying brand voice. Visual identity must balance authority with approachability. It needs to feel credible while still being warm, human, and accessible. This includes logos that symbolize care and trust, color palettes that evoke calm and confidence, typography that's professional and accessible, and photography styles that represent real patient experiences. Branding success must be measurable. Healthcare providers can evaluate the impact of their branding strategy by tracking patient loyalty and repeat visits, recognition through brand awareness studies, online engagement with branded content, and growth in enrollment or service line participation. A healthcare branding strategy cannot remain static. Patient needs, regulations, and technologies evolve constantly. Best practices include conducting annual reviews, monitoring healthcare industry trends, adjusting strategies during crises or regulatory shifts, and incorporating new technologies and channels as they emerge. Partnering with the right healthcare branding firm while developing a comprehensive strategy is essential for standing out in today's healthcare market. It's about more than aesthetics. It's about building trust, clarity, and confidence with patients. If you're ready to transform your healthcare brand, I encourage you to visit dn3austin.com to learn how Door Number 3 can help build a brand patients trust and a strategy that drives growth.